Hello everyone, welcome back again to my channel. This is Nurse Annie again, and to those of you who are new here, welcome and thank you for tuning in. And if you haven't yet, please do hit that subscribe button and let's connect. So in today's video, I will be sharing some tips for new and upcoming nurses, especially to those who decides to go to medical surgical unit, and of course, for those seasoned nurses who actually are new to medical surgical units. So to all of you, this video is for you. So if you are interested on this topic, then keep on watching. So the first thing I would advise you is to prepare yourself. I mean, you have to prepare yourself mentally and emotionally as you will be working as a new nurse. It would be a whole lot of adjustments, but I'm sure you can do it, of course. And of course, for those seasoned nurses who are, let's say, coming from a different unit and moving to MedSurg, then I guess you have to prepare yourself with more. So basically in MedSurg, you will be getting a total of patients more than the maximum in your 12-hour shifts. Of course, you won't be taking patients more than the maximum at a time. But I say this because in medical surgical unit, we have a lot of discharges and admissions. So let's say you have 4 or 5 patients when you started, but at the end of the shift, after your 12-hour shift, you might have a total of 10 or 12 patients in all, because of your admissions and discharges. So, I mean, you have to prepare yourself for these kinds of situations. Okay, so the second advice I will give you is have the willingness to learn new things. I mean, especially if you are a new nurse, you have to have the initiative to do things yourself. Take the accountability, the ownership, to do the things, to do the routines that are supposed to be done. For instance, you are with your preceptor, follow them, ask them, volunteer to do things yourself. I mean, of course, after seeing them do the things, then you have to volunteer to do it yourself. Don't just sit there and wait for your preceptor to tell you to do this or that. No, you have to be proactive. You have to have the willingness to learn new things. Even the little things that you think are easy or the mundane tasks that you think are easy. Believe me, it's much more harder than you think actually. Even the little things like doing your assessments, checking your blood sugar, referring your patients to the doctor. You have to have the willingness, to do these things, at least on your preceptorship period. So at least if you will be alone, you know how to do all these things. Or the not so easy skills that you can learn, like doing a dressing, accessing a central line, or doing a dressing of PICC lines. Those things can be learned even when you are still with your preceptor. That's the best time actually for you to learn. Those are actually simple tasks that sometimes new nurses are scared to do. So by the time they will be alone on their own, they don't know, they are having hard time doing these skills. That's why at least if you are on your preceptorship period, try to engage yourself, expose yourself to these kinds of skills so that if you will be alone on your own, you won't be having hard time. Even just the basic, skill of IV insertion, there are still nurses in the field, even after a year or so, they still having hard time putting an IV. That's why I said you have to, engage yourself. You have to volunteer to do things on your own. I mean, we don't have the same pace of learning, but at least you have to go there and have the exposure on the skills that you need in medical surgical, at least the basic ones, so that at least if you will be alone on your own, it will be much more easier for you. And with regards to this as well, you have to ask for help or ask for advices or ask feedback from your preceptor. This is one of the ways actually you can better yourself, because at least you will come to know the things or the areas you have to improve on. You cannot just be passive if you want to learn. You have to be hands-on and really have that willingness to educate yourself as well. Another thing I would highly encourage you to do is read up on the cases or some of the common diseases that are catered in medical surgical unit, and basically just read some things about these diseases. I'm not saying that you have to memorize all the signs and symptoms or the treatments or the diagnostics or anything intensive, but I mean just having an idea what it is does really make a difference and does really make you a better medical surgical nurse. Some of the common cases in MedSurg, but are not limited to, of course, COVID, pneumonia, hypertensive urgency. You have their UTI, COPD, DKAs, or post-DKA, cellulitis, just to name a few, but there are so much more. It's also always good to know some of the common medications that are given to these kinds of patients. I'm not saying that you go there and buy this thick medical, surgical, or pharmacology books, but at least you can also search in the internet. That does make really a big difference for you. For me, what I actually usually do is every time I will come across, a disease that I am not so familiar with, I will just go in the internet and search about these diseases. And in that way, I have an idea. And by the way, perhaps one of the best practical way to learn these diseases is read up, brush up on the patient's file. It does really make a difference in understanding these diseases, not just the diseases, but the patient as well. From H&Ps, from history and physical, consultation notes, progress notes, and even nurses' notes, you can, of course, read on those. And of course, you can always ask the provider. Most often than not, they are always willing to answer your questions. Another thing I would advise you to do is be sure to build rapport with your colleagues, especially if you are new in the field. You have to get along well with your co-workers, especially with the NAs, the nursing assistants. Oh my gosh, they can make your life easier. Believe me, they can make your life easier or they can make it hard. You don't just go to work ordering people to do this or that while you are just there sitting or chit-chatting with other people, You are a member of the team. You have to work independently but still along with other staff. You cannot just ask them to go and clean up your patients because you are the nurse and they are the NAs and they're supposed to do that. No, you have to be a team player. However, this also doesn't mean that you cannot ask them to do things for you. That's why there's delegation. You can, of course, delegate tasks to the NAs in a professionally appropriate manner, which will surely make your work so much easier to manage. Don't even have that impression that because you are a new nurse that you have to do all the things yourself. No, 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 no. Otherwise, you will be behind, not just in your patient care, but also especially in your documentation, which will end you up going home so late. So just remember, you will be a valuable member of the healthcare team. You have to know how to be a team player, when to help and when to say no as well. You have to know your strengths and weaknesses, and you have to have the willingness to learn new things and make every effort to improve your craft. Next advice I will tell you is be sure to improve on your time management skills. This is really, really important, especially that, as I've said earlier, in medical surgical units, you will expect turn of events. You think you might be having a good day with 4 patients, and the next minute you're all having these discharges and admissions non-stop. So you really have to develop your skills in managing your time to the fullest so you won't end up going home so late. I will be making a whole new video about this topic, just some tips on how to effectively manage your time so you won't be, going home so late, and I will be making that very soon, so watch out for that. Okay, so the last but not the least thing I would advise you if you are planning on going to MedSurg or any nursing discipline for that matter, and to those new and upcoming nurses in general, is always have that enthusiasm to learn, to work, to dedicate yourself in caring for other people, irregardless of race, color, background, or any social, religious, or even gender affiliation. You have to take pride of being a nurse you yourself would want to nurse you if you are on these patient situations. I mean, nursing is one of the 3 most noble professions in the world, and you should be proud, and let us prove that we deserve this commendation, isn't it? So to all of you new nurses out there, welcome to our world, the world where you can always make a difference in the life of other people, and of course, the world as a whole. Okay, so that's it for my video for today, and I hope you learned a thing or 2 on this video. And if you did, please don't forget to hit that like and share button. And to those of you who are new here and haven't yet subscribed, please do so. Hit that subscribe button and connect with us. So that's it for today, and see you again on my next video. Bye bye.